Okay, I think we're live. Sorry, I had to get a drink there. There's nobody on the stream now, so it doesn't matter anyways. How's everybody doing? Hopefully they're doing good. I got to point out, this is just a little bit of business first. I in one of the last videos that I did, it's been 2 years ago. Was the last video that I posted, and in that video, I had a toothpick in my mouth. I always have a toothpick in my mouth, and I normally have it down right here, and it drove a couple of people absolutely insane. They commented on it, so no more toothpick. I'll keep it in there after the video. Uh, Getting over something here, so excuse me if I sound a little gross. So yeah, a little bit of an update. Basically, when you last heard from me, I was recovering from PACS, or long COVID, as it's known. Um, had a great recovery, followed the protocol that is widely available out there now, and anybody can see it. Anybody can find it. There's a couple of websites. The FLCCC website is a great place to do some research. I'm fully understanding that we are at the behest of the WHO rules and guidelines for what's acceptable to say on here now, which leads me to my next point. So I had made a video about recovering, and that video went it got quite a few views. I think it was up to like 9 or 10,000 people had watched that video. It was a live stream that then got turned into a video, and then it got yanked from YouTube, and it was my second strike. And so the first strike is just like a hey, warning, slap on the hand, no big deal. The second strike is a little bit more serious, it turns out. The second strike, when they decide that you're spreading, what is it? One of the three informations: mis, mal, and disinformation. In my case, it was medical misinformation. Again, I'm not a doctor. Clearly, I am not a doctor. But at the same time, I was just kind of saying what had worked for me. And in that case, the protocol that I used, that you can find on your own, works great. So I got an email from YouTube saying that my channel would be locked down, and that I would no longer be able to. I still, because we pay for YouTube Red, so I'd still be able to go online and download videos and do all the same stuff that I did. It's just that I had zero access to this channel. I couldn't do anything. I can make videos. I can make them. I just couldn't post them. And I'm sure that all my stuff got I don't know, buffeted down. There's no demonetization because I don't make anything from this, but I'm sure that it got knocked down in the algorithms so that the people that were looking for it couldn't find it. It's fine. It happens. No big deal. But I just kind of decided, fine. You know what? It's not my it's not my company. I don't get to decide what content they put on there. Although there is some real questionable stuff on here, but that's totally fine. So you guys go ahead and made the decision. Fine. The big guy won, and I'm not going to argue. And we'll just let bygones be bygones. I'll pay you for your services every month so that I can still download videos and watch them offline and stuff like that. I waited. I think it was a 90-day strike, or excuse me, a 90-day ban, if you will, where I didn't have access to my channel. And so I decided to wait after the 90 days. And, a lot of things changed in 90 days. And so I went ahead and sent them an email where I had linked to a bunch of articles and research papers that had come out that were kind of a little more on my side, and said, hey, look, here's the information that's widely available online. How is it that what I'm doing is somehow verboten when this is all anything that anybody can find this stuff, and it looks like some of this stuff may have a little bit of credibility to it. Well, I got an email back from him. It was like 3 months. I got an email from YouTube, and it was basically a whoops, sorry, you're right, we screwed up. And um, so I got access back to my channel to be able to do stuff. Went ahead and reposted the video because it was the one video specifically that they had a problem with. So I went ahead and reposted the video, and I posted the video, and within 24 hours it got taken down, and the strike was reenacted on my account. So it was another 5-6 month ordeal. where I was emailing them back and forth, and it actually got run up the well, it got run up the chain. I don't know, somebody from YouTube with a YouTube email address. I was in communication with a few times, and they finally uh, basically told me to pack sand. There's nothing that you can do. You're spreading medical misinformation, and so if you don't like it, go somewhere else. And I thought, all right, fine, yet again, you know what, you guys won. And so I just kinda let that one expire, fall off, and then eventually got access back to my channel here. Not like I have a whole lot of followers or that there's a whole lot of videos out there, but I do tend to, watch a lot of videos on here, and, um, I figured this is probably a good place to kinda turn for help. So the short version of what happened was, as you know, I got over, I ended up getting COVID long time ago, got the Pfizer vaccine, both shots, didn't get any boosters, but got the Pfizer vaccine, hoping that it would help with long COVID. That was right at the very beginning of the when the vaccines were available and or the mRNA therapies, not traditional vaccines, but the mRNA therapies were available. I went ahead and got those two, hoping that it would kind of help because boy, the long COVID is no joke. That sucks. It is horrifically exhausting. And at any rate, yada, 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 I ended up getting over long COVID, fully recovered. Everything was fine. Went on about my life a couple years. Honestly, didn't really think of it ever. It wasn't anything that popped up. And then I had an accident. It was a overuse injury at work, not really a specific accident, but it was a overuse injury due to the nature of the job that I have. That my knees ended up giving me tremendous problems. So I decided, well, I didn't decide. I went through with a couple of knee surgeries, not knee replacements. That would have actually ended up being a far easier thing to go through. It turns out knee replacements are something that's pretty commonplace now. And in my case, what they did to me was lateral Z lengthening. Uh, I'll give you the dumbed down version. They go in on the backside of your patella tendon, and or on the backside of your patella, excuse me, your kneecap. Mine look like a forest because my kneecaps ride a little bit higher than the average person. So if you think, get in front of the camera here. So if this is essentially your knee, if this is the joint, your patella is supposed to kind of cover the gap. Sorry, it's hard to do this. Your patella is supposed to cover the gap in between those two, right? Most people's do. I always thought everybody else had weird looking knees. Turns out that mine are the ones that are screwed up. Mine ride a little bit more kind of up here, like in this realm. So as I'm walking, they kind of grind right on that top part of the joint. And over 20 plus years of doing what I've been doing, they just wore out. And then that led to some pretty wicked inflammation, and that inflammation was concerning because I couldn't really walk, and so I went to the doctor, and they were like, "Yeah, this is definitely something that is, this probably wouldn't have happened had you not been doing what you're doing for so long." I may have been in my 60s or 70s as opposed to in my early 40s when it happened. So at any rate, all right, whatever. What do we got to do? So we tried a lot of therapy, went through months of PT, didn't ever really seem to do anything, and I got referred to a couple of the best doctors in the state. One of the best surgeons in the state is a joint and specifically knee surgeon for Colorado Avalanche, the Denver Nuggets, the Sea Buffaloes. So the guy's well known. It's not like he doesn't know what he's doing. And he looked at things and was like, "Oh yeah, no, I know exactly what this is. You got patella alta, and because of your job and what it is that you do for a job, they got worn out, undoubtedly. But the good news is we can fix it. We go in there and we clean up the backside of your kneecap, smooth the forest down, so to speak, because I was having a lot of pain right behind my kneecaps, and they did MRIs to look in there and see what was going on. Turns out the joint itself was fine. It was specifically the backside of my kneecaps. So they go in, they do the smoothing of the polishing, if I guess if you will, the backside of my patellas, and then they had to go because my kneecaps were a little bit high, naturally. They wanted them to kind of come in and a little bit to the outside. So they go on the outside of your knee and they make an incision and kind of release the muscle a little bit so that your kneecap can kind of roll a little more into the center. And then they tighten it up down on what would be the bottom inside of your knee. If you're facing forward and we're talking about the left, or yeah, talking about the right leg, they cut on the top left and they tightened on the bottom right, if that makes sense. It's there's a long, complicated name for it. I don't know what it is exactly, but that's what they ended up doing. So went through with that process. I did the left one back in, I believe it was October of 22. I want to say. I think it was October of 22, and started PT right after that. And it was supposed to be, 6, 8 weeks, 3 months at the most, and I'd be back to 100%. And at about the 6 to 7 week mark, my knee just kind of the muscles kind of stopped cooperating. The quad muscle, the big one on the outside, the quad muscle is actually four muscles. That quad, but just call it quad. The big muscle on the outside of my leg was slowly but surely starting to come back, and I was having a lot of pain. And I would get to the point where the bigger problem was that the part of my quad, the inside muscle on my left knee, it just stopped working. Um, through nerve damage or who knows. I would imagine it was nerve damage because I was an avid cyclist, runner, not so much running, but trail hiking, backpacking, climbing 14ers with my friends, and that looked like it was not going to come back. Excuse me. And so they they said, "Well, maybe you're just kind of on the long side of the curve. Maybe it's just gonna take a little while for that to come back, and, um, we can go ahead and do the other one, and once we do the other one, then we'll kinda rehab both of them at the same time." And I thought, "Alright, sign me up. Let's do it." And so they went ahead and did the right one in April of 23. It's been a long time, and the initial injury was back in, like, January of 21, I think. So they did the second surgery in April, and the same thing happened. I got about 6 weeks, give or take, out, and, it just progress kinda stopped. Once the surgical swelling and pain and stuff went away, I just couldn't build any muscle, and I would get to a point where when I was doing the PT, PT hurts. Undeniably, it hurts. But I would get to a point doing the PT that it would just kinda shut the muscles off, and so, I'd be trying to do like a straight leg raise or not really squats, but like non-weighted, or, one that I was doing a lot was with a rubber band, as I was doing, like, knee bends, pullbacks, and trying to kick out. I would just get to a point, like, say you're sitting down on a chair or whatever, and you try to just straighten your leg. Uh, I could do a few of those, and then I would get through maybe 10 on each side, and when I go to do the second round, I make it through maybe 5, and then the muscles just, like, off, lights out, they don't work. So, fought with that, made it through PT, just really plateaued, didn't get any better, and they kinda started running out of answers, like, "Well, we're not real sure exactly what's causing this, but it's gotta be something that we can fix." So, we we tried, more therapies. I went and saw more surgeons, more doctors. They did, dry needling, which was an interesting experience. Not super painful, but not super comfortable. Also remarkable when they put a little tiny needle directly into the muscle with a tiny electrical current and just kind of pulse that, because their idea was that, well, maybe the muscles just need to wake up and then they'll start firing again. And then that'll kind of balance things out and hold your kneecap where it's supposed to be. And then you won't have so much pain, and then it won't shut off, and then you can progress. So I tried everything that they wanted. Hang on, I'm gonna cough. Okay, better at least it's got a mute button. We tried everything, and finally in September of last year, in September of 23, They decided that, I was fully willing, like, just get me back to where I was. At that point, at this point, I would kill to go back to even where I was when my knees were hurting all the time because it was a different kind of pain and it didn't hurt anywhere near as bad, and the muscles didn't shut off, so I could still use them. I kinda pushed through it. So in September, they decided, let's do PRP. For those of you that don't know, platelet-rich plasma, or PRP, is something commonly used. It's really good in soft tissue injuries, specifically tendons, ligaments, muscles. Not so much for joints. Joints are more a realm of stem cells. But PRP has been tremendously successful in helping people that have what they were thinking. What my issue was, which was maybe because your patella tendon was, kinda stretched, for lack of a better term, maybe this would kinda help tighten things up a little bit, and that would allow you to, it would stabilize it, it would strengthen the tendon, and then if that was stronger, it would hold things in place, and then it wouldn't hurt, and then the muscles could work, and you can kinda see how this whole thing works. So, they, we went ahead and did PRP, walk you through the process. It's the most horrific, painful thing I've ever had done in my entire life. They take hold them up. They're 4 or 6, I think it was 6 syringes that are about machine, a centrifuge that heats it and spins it, and that creates, the plasma, and what they're looking for is platelet-rich plasma. One of the doctors had told me along the way that the count that you're looking for is somewhere over 1,000,000. Not sure what that million is referencing, like maybe 1,000,000 platelets per deciliter, nanoliter. I don't know what the measurement is. I just know they said that they were looking at 1,000,000, and they do a blood test ahead of time to know what your regular platelet count is, and then this machine will increase it by however many times. And if they don't get to the point they need, then they just keep heating it and spinning it until they get what they want. So I go in, they take out a massive amount of blood, and they heat it, spin it, and the lady comes back in. The PA comes back in, says okay, and I had asked her if they were gonna are you gonna, like, numb anything up first? Are you gonna like, how bad is this gonna hurt? And she said, "This is the most painful process that we do in the clinic." Now, I have since learned that you don't have to have nothing injected ahead of time. You can absolutely there are places absolutely that do it, I don't wanna say pain-free, but they do it with a lot less pain. They inject a little bit of lidocaine or another, numbing agent in there to kinda help, and I know I gotta get trimmed up here, I look horrible. Um, but they can inject something in there to kinda take the edge off, so to speak. I didn't have that option, and so they lay you back on the table, and I threw in my earbuds and was trying to meditate and do some breath work, and into something that already hurts really bad because at that point, the tendons were tender, not inflamed, there was nothing wrong with them, it's just kinda everything was a little tender, I guess, is the best way to describe it. They stick a giant needle, and they have to do it in multiple spots. It's not just one injection. They put the needle in and inject, and then sometimes they'll do multiple penetrations, but in this case, she said that she doesn't like doing multiple penetrations because, as you can imagine, it's a large gauge needle as well. So they go in and inject and then kind of pull back and rotate and inject, and they do all this using, ultrasonic for guide so that they can see where they're injecting. In this case, they injected it directly into my patella tendon. Thought, okay, and it was yeah, it was horrific, not gonna lie. It was the most painful thing I've ever been through in my entire life, and I got through it and went home, and they say, "Okay, now you can do nothing. No, nothing for about a week. You have to lay around, but don't ice it, don't heat it, because you really want that plasma to sit there and kind of encourage the inflammatory response, your body's natural response to kinda come in and, start doing the repair, to bring send in the reinforcements, for lack of a better term." And so you basically lay around and do nothing. Laid around, watched TV, a lot of World War II movies and shows, mindlessly scrolled on Instagram, stuff like that. I couldn't make any videos at the time because I didn't have access to my channel, and so, otherwise, I probably would have made videos about me just sitting around doing nothing, and how bad it hurt. Oh my god, did it hurt. And you're not supposed to like walk a whole lot for obvious reasons. I suppose if you get it in your shoulder, you're not supposed to use your arm a whole lot because you don't want all the things that you've been taught and that we've learned our entire lives about how to treat an injury. You have to do the exact opposite of that, which is just sit around and let it get as inflamed and angry as possible. And that's what's supposed to happen. So I had that done in September. Now that process is only supposed to last the inflammatory response. Some people it goes away pretty quick. I tend to have a pretty active immune system, so I was anticipating for me it was going to last a little bit longer, and it turns out that it did. Um, it never went away. It that's part of the reason why I'm here because it never went away. The inflammatory response happened. Anytime you got inflammation, things get tight and swollen and hot, and that's what happened. And it just never went down. And after 6 8 weeks, was talking to the doctor, and he said, well, "I've never seen this before. This isn't anything that I've ever experienced before." And I thought, "Yeah, no kidding. This is nothing I've ever experienced before either." Hang on, I'm gonna get a drink here. It's just water. And so, yeah, no, I've never experienced anything like this before either. And from what I'm reading, this isn't like a normal thing to happen. This is most definitely not what is supposed to happen. And so we kind of went back and forth. It was more like, well, just we'll keep checking in with you, and things should get better. Finally got to the point where they kind of were like, well, look, we're out of ideas here. We don't really know what to tell you. So maybe you should go talk to another surgeon and see if there's something that we missed. And it's always good when one of the a surgeon who's one of the top in his specialties in the entire state tells you we don't have any idea what to do. We're not real sure what's going on, but we also don't know how to fix it. So go talk to somebody else. So they sent me to another surgeon. And at this point, I was thinking, like, not that they don't know what they're doing. They absolutely know what they're doing, but they don't know what's wrong or they don't know what's causing it. They don't know what's wrong. So I go talk to this other surgeon, very nice lady who wanted to be very conservative about her care, and being conservative involved cutting my patella tendons out altogether and replacing them with cadaver tissue, or donor tissue, as she said. There was also some experimental treatment that they could do. I don't remember what it's even called now, but essentially they would cut my knees open, go in with a needle, hooked to an ultrasonic machine, and try to break up. Oh, so I should backtrack. I got MRIs done in July. Was it July? Yeah, in July. In July, they looked at my tendons. They want to know what was going on. And for those of you who have never looked at an MRI, tendons generally, well, at least my tendons under the MRI, everything leading up to the surgery, they were nice. They looked healthy. They were, essentially solid black. You could see a couple little striations, but really nothing. They were pretty much solid black, very normal size, not inflamed, nothing wrong. The results that we got back from the MRI that she wanted to see what was going on in there, they had grown to roughly 3 times their normal size. Instead of being nice and black, they were mostly white. You could see, like, these white lines, just solid white lines, and they were huge. I mean, they're so big, they stick out of my knees now in the front. You can see them where, before you couldn't. I should say, you could probably always see your patella tendons. Mine are very prominent now. They're the leading edge of my knee. They stick out real, real far. And so she goes in, or she tells me, "Well, based on what we're seeing, we can take this needle, ultrasonic machine. It begins with a T. I don't remember, Timu or Tim's or Tensor or something like that. They go in there and they try to break up the fibrous tissue with the ultrasonic needle, and then irrigate it out, flush things out. And then the hope is that it will start the healing process, with good, clean, new tissue. And turns out that it's not something that you can find good reviews about it, but one of the side effects is permanent nerve damage, which I was thinking, on top of the fact that I can't really use my knees, I have a hard time just walking at this point, and doing anything that I did before is completely out. If I added into that permanent nerve damage, that just sounds like something I'm not real interested in. And the only other option is to cut them all the way out and replace them with donor tissue. and that's also not really something that I'm looking forward to, or was not looking forward to. I'm not doing it unless I have to. Interestingly enough, on the MRI report that I got back, other than developing severe tendinitis, which wasn't there before the injections, it's so severe that my patella tendons are at an extreme risk for rupture just on their own. So yay, that sounds fun, doesn't it? Um, so at any rate, I decided, I think I'm done with this, and had been kind of trying to see if I could figure out what was going on with them before, but then really, really started to deep dive, thinking like, okay, if they don't know what's going on, then I'm gonna have to start doing my own research. And I know that that's been frowned upon tremendously in the last few years. Definitely don't do your own research. Just listen to the experts. But when the experts tell you we have no idea what's going on, you have no choice but to kind of start doing your own research. So this leads me to 25 and change minutes later, why I'm actually here. I'm gonna start doing more videos now that I have my channel back. I'll try not to get on the wrong side of the law again like I did last time, but if I do, then I'll have to take all 0 of my subscribers and jump over to Rumble or X, Twitter, whatever it is. But hopefully I can keep things within the legal boundaries here on good old YouTube. So, beings that I had, I started researching into I had I've gone through so many papers at this point, I don't even know. I had read a paper through the NIMH, or yeah, I think it's the NIMH, through through their website, through PubMed, that was talking about specific blood markers that people that ended up with long COVID had. And it turns out they have the way that their immune system works, and this would be no surprise to anybody, but the way that their immune system works is slightly different than that of other people, the way that their immune system works. And that's kind of why they got long COVID. It has something to do with IgG6 and I believe IgG4 are the two specific immunoglobulins that it has to deal with. I believe it's a deficiency in one or both of those, and the way that they're expressed, the way that your immune system works, essentially. Interestingly enough, as I started pulling out little snippets of phrases out of those papers, and then searching more around those phrases, it started leading me to understand that this is potentially going to be kind of a large issue for a number of people. I found one paper on PubMed that was talking about an individual who had shoulder tendonitis and who ended up getting PRP injections in his shoulder, and he developed a similar thing. And now the way PRP works, the safety of PRP is almost unquestionable because they just take your own blood, heat it up and spin it, grab the plasma, the platelet-rich plasma, and shoot it back into the spot that's messed up. You shouldn't be allergic to your own blood. But it turns out it doesn't work like that. There are some reports of people who've had PRP and they have like an immediate reaction. It's more of a not like an anaphylaxis reaction, but they have an immediate immune response, I should say. But it's usually really short lived. And in my case, it's been going on since September, so anything but short lived. Uh, so if you look at people who, and this is where I have to ask if anybody out there has experienced this or if they've heard even peripherally of anybody else experiencing this. If you look at people who ended up with long COVID, who got over long COVID, or maybe they didn't, but people who also got either of the jabs, there seems to be a correlating factor in there where people that got the jabs, which, hey, if you wanted to get them, great. If you don't, great. Don't really care. But they're starting to look into the research now is diving into people that ended up getting specifically the P or the M jab, that those people who developed long COVID either before or after getting those jabs tended to make that spike protein, which is how the mRNA vaccines worked. They programmed your body, right? They sent in a little chunk of messenger RNA to kind of program to send a signal to your immune system to so that it could identify, so that it would produce the spike protein, so that it could identify it and help you get better, so you didn't end up getting extremely sick. And it looks like there's a correlation between, or I guess I should say, it'd be great if anybody else could corroborate this. there's a correlation most definitely between people who have the blood type that would allow them to get long COVID or PACS, and those same people that got the P or the M jab, they produce the spike protein much longer than the people who either got the jab or didn't get the jab, but didn't get long COVID. That's the most important thing because that long COVID seems to be that whatever it is in your genetic makeup that predisposes you to getting long COVID, that kind of seems to be the big problem here. And if you think about the way these work, so if you take your blood out, spin it up, and predominantly the spike protein is carried in your immune system in your plasma, then you inject that and elicit an immune response, which normally would be no big deal. People who got long COVID because of the way their immune system reacted during the infection, it's just kind of a vicious cycle where you inject something into your, in my case, patella tendons that caused them to elicit an inflammatory response, which released more of the spike protein, which then caused them to have a stronger immune response, inflammatory in this case response, which then released more spike protein. So it's this vicious cycle of your body is attacking itself. It's also no secret, and there are plenty of papers out there talking about the number of autoimmune disorders that have popped up since the thing that happened a few years ago. And it's kind of a similar situation. A dysregulated autoimmune system is essentially what people who had long COVID have, right? They're stuck in that inflammatory response where their body is attacking itself. That's what rheumatoid arthritis, lupus, those autoimmune disorders, that's what they're based off of. Right? That's the functionality of them. Is that in the case of RA, I know that there's been an increase in the number of RA diagnoses here in the last few years, and I'm not blaming anything for it. There's no, I don't, I got to work within the WHO guidelines, so I am definitely not blaming any company or anything that happened on that uptick in the number of diagnoses for autoimmune disorders. But facts are facts. It is happening. And in my case, I truly believe that that is what's going on with my patella tendons, with the reaction that I had to PRP. And I've talked to a couple of doctors, one specifically that I trust tremendously, and he tends to think that I'm on the right track, but, as of now, there's not really any research being done. That's why I'm here. I know this video is probably not gonna go viral. Even if it did, I don't make any money from any of this stuff, so, 'cause I don't have enough hours or whatever. Mainly, I'm just looking for answers to see if there's anything out there that anybody has done that or any stories that they've heard, specifically. I know that, a lot of joint disorders have started showing up. Again, that's would be the RA thing, but not even RA specifically, but a lot of joint disorders have showed up, since, well, for the last couple of years, last few years now. But specifically was curious if anybody out there had heard of or experienced themselves getting PRP injections, but they were also a person who got long COVID. Whether you got the jab or not, I'm not sure that that matters. Maybe it does. Maybe that is the thing that matters, but I don't know, and they're not really doing any, or I'm sure they'll be doing research on it someday, but it doesn't appear that there's a whole lot of research going on now. They're still trying to figure out what causes long COVID, other than this dysregulation of your T cells and your IgG. I believe it's 4 and IgG6 would be the two. So based on that, I mean, we're kind of out here on our own trying to figure things out. So I've started up the I Recover protocol that is widely available online, and I take a number of supplements now that have been widely shown. Serapeptase. I can't take NSAIDs, no ibuprofen. It really wrecks my gut, which would be something that would potentially help this tremendously, but it's not anything that I can take. So serapeptase is available. I take 120,000 IU, I think is the measurement. Take that. NMNH, I believe, is the other one. Nattokinase is another one. NAC is another one. as well as my normal like vitamin D, multivitamin, methylated multivitamin that I take, fish oil or krill oil in this case. I just get stuff from Costco. Stuff is awesome. Really good for joint health. Was recommended to me by my doc. I'm trying to think of what else I take here. Zinc, but that's just more like an overall immune thing. But I think at this point now I take somewhere between it's like 18 or maybe even 20 capsules a day of these things. Now, the serapeptase, the idea behind the serapeptase, they traditionally have used that to break up fibroid tissue, fibroids, which is what the doc. I kept hearing him refer to the white striations that showed up in my patella tendons on the last MRI as fibroids. And so I thought, well, there's got to be something that there must be something out there that helps get rid of those things. Turns out serapeptase, it's Serapeptase, I believe. Turns out they give that to a lot of cardiovascular patients, which is also interestingly another thing that they're starting to see a whole lot more issues with cardiovascular health and heart disease in the last few years. So I had just a brief second. One person was watching the stream and then they left. So it's no one is watching this, which is fine. I don't care. Um, so Serapeptase is has been shown. They did a lot of studies in Japan where it was shown to kind of break up the fibrous tissue, fibrin, in your cardiovascular system. It's really good at getting rid of that, at breaking that stuff down. You got to be kind of careful because it can cause bleeding, from what I understand. Which, like if you get a, excuse me, hold on, I got a cough. I'm not sure. Oop, get caught up here. If you get a cut, if you're going to bleed to death, but I don't. I know that that's one of the things they warn you about when you're taking it is uh, that yeah, because it breaks up the clotting function in your blood, obviously, and so your blood is a little less likely. It's probably I don't know if it's considered a blood thinner. But it's definitely something that if you're on any other medication, like do your own research on this stuff. I'm not sponsored by John Deere, but it's the most expensive hat and mug that I own because I'm a Deere owner. Uh, I'm clearly not a doctor. I'm just telling you that this is what I've started trying to figure out is what it is that I should take. And if anybody else has got any other suggestions for things to kind of help break up that fibrin, because that's kind of what I think is the part of the issue. Getting the inflammatory response under control is something that I know how to do. I just honestly got to really dedicate my entire life to doing it. For me, it works good to eat a keto style or like Paul Saladino modified carnivore style diet. Meat, fruit, uh, eggs, a little bit of honey, a little bit of dairy is all I eat now, and I definitely notice a difference. If I have a tequila with the wife on the weekend or something, I wake up in the morning, the knees are significantly more painful. No sugar. Sugar absolutely is a huge inflammatory thing for me, so I got to stay away from that. Turns out I've been reading up on intermittent fasting because I guess that's a good thing to promote autophagy, which is kind of the body's way of clearing out all of the dead bad cells. So I really got to attack this with everything that I've got. I've been trying, but it's a little bit disheartening because nothing that I've done so far seems to work. But I finally got this last round of supplements here last week and finally started taking them today um, because they can cause a lot of gut issues. So you got to take them kind of spaced out throughout the day or between meals. Follow the directions on the label. I use Pure Encapsulations. They're not a sponsor. I don't have any sponsors, but they're so far they're incredible. I had heard about them from Gary Brecka, I believe, podcast I listened. He had recommended some of their stuff, and so far, I guess they're good. But just follow the directions on the bottle for what you're going to take. But yeah, I guess that's it as far as the health front goes. We're gonna try to keep fighting this thing and figure out a way to get my knees to function because I can't do anything right now. Uh, Walking is tremendously difficult. I haven't slept a full night in over a year, or I guess coming up since the last surgery in April. So just shy of a year, I haven't slept a full night without waking up in tremendous pain. Turns out there's a not surprising if anybody's ever fallen on their knee, they know how bad it hurts. but there's some specific nerves that are behind your patella tendon, and when they're really, really inflamed, it kind of pushes on them all the time, and so that causes me to wake up uh, multiple times throughout the night in tremendous pain like I've fallen on my knee, that like ticklish but also nauseating nerve pain. I get that all the time. um, but as the doctor said, I can still go to work. She was real adamant about, well, at least you can still work. um, Whatever. I guess that's all we're here for anyways, is to work, right? I tend to believe something a little differently, but I'm just happy to have my channel back and be able to do something. And if anything I've said here rings a bell with anybody, or anybody has any ideas, by all means, throw them in the comments there, and hopefully we'll be able to figure out what's going on. If anybody's got any papers that talk specifically, I probably have read all of them at this point, talking about the different immune regulation, or immune system regulation and dysregulation and autoimmune disorder, and what all that stuff means in regards to people that had they call it PACS now. It used to just be called long COVID. Um, and I guess we're gonna go from there. I guess I will say this: this channel is not just going to be me complaining about my knees and asking it for people's opinions. I'm not giving any medical advice. I have to state that very clearly. I'm not giving any medical advice. But I'm gonna start covering a bunch of topics. Now that I've got an outlet back, I figured I might as well. So, at any rate, it looks like we're at about, I don't know, like 41 minutes. I've rambled on long enough. I got stuff to do. It's my day off, so I still got to go do the dishes and do all the household stuff. But yeah, I hope everybody has a great day and take care of yourselves and each other. Bye.